Hello and welcome to our monthly presentation. My name is Sarah Davidson and I'm the clinical coordinator at Hospice of Anchorage. This go around we wanted to talk to you about communication at end of life, the importance of it, the complications that come with it, and how we might be able to better support you or provide resources for the many situations we come across when we talk about communicating at end of life, especially with those living with life-limiting illnesses. Just a few quotes that I wanted to share with you that really encompass the importance of this topic, where communication at end of life is an integral aspect of a good death, an essential aspect of palliative care. Family members and caregivers continue to recall communication about end of life care for years following the death. Very memorable conversations. So why is it so important? Well, communication at end of life has been said to really provide the opportunity for family members and caregivers to meet relational needs with the terminally ill. It's also a way to maintain and or enhance the relational bond between terminally ill and relational partners. It's an opportunity to create new memories, to share important moments, and to give final messages of love. Sometimes it's some of the most intimate moments, intimate conversations, and words that we are sharing in those moments at end of life. It provides that urgency to say a meaningful and heartfelt goodbye. A lot of people have the opportunity to say goodbye and others don't. So when you do get that opportunity, it is usually very, very meaningful. It also creates a space and time for people to acknowledge their fears and concerns about death and about life without one another. And it's also the last opportunity to forgive past hurts and resolve conflicts and allow survivors to achieve a sense of closure, hopefully. So some of the outcomes of effective end-of-life communication can look like this. Patient's voice being heard more clearly and their desires are a priority. When both patient and family or caregiver have an open communication, all parties are likely to be more ready for end-of-life care and therefore increase the likelihood of a better quality end-of-life and support network. They're much less likely to implement artificial life support to prolong suffering as well. An interesting fact I found when researching this study on end-of-life communication found that it was a study done of 1,000 US patients with cancer and focused on their end-of-life care discussions. And they had these discussions prior to the last 30 days of life. And because of that, because they were able to have these conversations prior to the last 30 days of life, they were significantly associated with fewer aggressive medical interventions. So in the beginning, that one quote referred to, a good death, and a lot of people wonder, what does that mean? And oftentimes it means that clients' wishes are communicated effectively. They're able to share what they want done or not done when it gets to the point of medical care, treatment for their diagnosis, or even where they want to die or who they want around, things like that. Some really important things, whether or not people want to be intubated or have their body donated, things that are important to talk about before life gets really stressful and hard to have those conversations. So in this particular study, because they were able to have that conversation at least 30 days prior to the end of life, getting 30 days prior to them dying, they had less prolonged suffering and less artificial life support that a lot of people generally don't actually want when they experience the reality of it. So there's also the patients are more willing to have authentic conversations that create a sense of closure and completion with their loved ones when they can have these conversations openly, which can be an amazing thing for those who are going to live after their loved one has died, to be able to have that completion of communication and closure is a really unique and special thing. So providing that opportunity is important. So another study focused on this tool called the Final Conversation Scale. It's a measure of end-of-life relational communication with terminally ill individuals. This particular study included 152 participants who completed this instrument and analyzed the final conversations they had with their loved ones. They also said that this research study was said to validate the past research on the importance of final conversations, as the messages that were shared at end of life are considered to be extremely powerful and long-lasting memories for participants. So these are some of the themes that they found when they had these participants complete the final conversation scale. And those themes consisted, number one, of messages of love. So they talked about verbal messages of love, referencing I love you, or you mean so much to me, you're so important to me, or nonverbal messages of love, such as kissing, hugging, holding hands, or even eye contact was still a really strong message of love. Messages of identity, so statements that reflect the evaluation or construction of self. Many times people wanted to talk about what's, who they are, what's been important to them in their life, what they want to be remembered for, things like that, as well as messages of spirituality, direct declarations of faith, a readiness to be with their God, discussions of heaven and afterlife. So this theme and conversation came up consistently, as well as everyday talk and routine interactions. So a lot of the time, conversations for those who are terminally ill are focused on their treatment and their medical care and the doctors and when their next appointment is. So having the opportunity to share news and activities, maybe of the family, our daily rituals, can offer kind of a normalcy or structure for the client who is living with this illness or getting close to end of life. As well as another theme was the difficult relationship talk. So this was very specifically referring to those who already had challenging relationships with certain individuals. They said that they were able to address issues and problems, letting go of anger, not blaming each other for things that had happened in the past, maybe grudges that they've held for years and years. So being able to hopefully have those conversations around the difficult relationship and let go of that, that heaviness that either one of them may be feeling. Finding that peace before they eventually say goodbye. And another theme was the messages pertaining to needs and final wishes. So clients were able to share their fears, their desires, and their needs in regards to one's terminal illness. And that was extremely important, to not only share your dreams or your desires and wishes for end of life, but also to discuss what your fears are. What are you afraid of as your life does come to a close? What are you afraid of as your diagnosis gets worse? Are you fearful for your family members or what you're leaving behind? Things like that. Being able to have those honest conversations were really important. So another really important aspect of this that we wanted to touch on was end-of-life communication and dementia. End-of-life communication can already be a challenge in itself, and then we throw in the piece with dementia and it's a whole different story. So I wanted to be sure to touch on this a little bit here and refer to another just resource that I found that talked about a trip back in time as a model for communication when living with or loving a loved one living with dementia. The purpose behind the title Trip Back in Time is to help us recognize that oftentimes those living with dementia are living in a different reality than we are, or at least the majority of the time. So this model attempts to avoid the frustration and heartache from an unnecessary reality orientation. I've come across many people who aren't as familiar with dementia and find themselves in many arguments with their loved ones because their loved one believes, that something is happening that may not actually be happening, or that a loved one from the past who may have even died, they'll be talking about them as if they just talked to them yesterday. Just some really brief examples of what it can be like to try and interact with somebody who is, in a sense, taking a trip back in time. So that trip back in time model also asks loved ones to refrain from attempting to identify, grandchildren or family members, because it's, if you've had any experience with dementia, you will notice that most of the time, or a good chunk of the time, many individuals do not remember the names of their family members. They start to lose recognition of those, even their children or their siblings or whoever they may be, and trying to help them identify them can actually become really challenging and frustrating for not only the patient, but for the family member as well. So not challenging them with quizzes on what name belongs to which child, or even if that's your child, can be a good thing. And then, so just really all put together, it's just about joining that patient in the trip back in time, connect to where they are at that time. If they start talking about a memory, you could try asking them about that memory, or just being there to listen to them as they share it with you. Even if the sentences make no sense or they can't connect the stories, oftentimes just being a listening ear, an open heart, even just your being there and looking and listening to them is so powerful when they are sharing these memories with you. Another challenging part of this is communication around pain management with those who have dementia. It can be a challenge to know when somebody who is living with dementia is feeling pain, as well as where is that pain, how can we take care of it. And one of the things that even increases that challenge is either under or over medicating them, because that can lead to increased cognitive impairments. So if you have somebody who's living with dementia and they're not getting the medication they need, they may be experiencing a lot of pain, and due to that, they're unable to spend any time focused on trying to communicate because they're experiencing pain, but they can't communicate that pain. So it's really important to pay attention to any physical gestures that you notice. I've seen a client of ours, often she'll place, her hand on her mouth, and we can eventually conclude that she is feeling pain in her mouth, and make the moves to get her seen by a dentist or the doctor or whatever it might be. So really paying attention to those physical indications that they may be feeling pain but can't communicate it verbally. Also, antipsychotics are often prescribed for anger and aggression, which can further impair communication. If somebody with dementia is experiencing a significant amount of anger and aggression, those antipsychotics may be very necessary. Every situation is so different. Every person reacts very differently to certain medications. But due to that, it can also really impair their ability to communicate with loved ones, around their needs and such. Another just a little fascinating fact I found was that elders, referring to those over the age of 65, are actually the largest consumers of prescription medication. Overuse of medications for end-of-life dementia can cause like we're talking about significant impairment in social engagement. So a crazy statistic that I found was that 13% of the population comprises elders over the age of 65, yet they consume 34% of prescription drugs. So it's very, very important to be educated on dementia if you have somebody in your life that you're caring for, or even, you know, especially as a doctor, clinician, nurse, to be educated on dementia, what it can look like, and understanding what medications are actually needed, because family members and caregivers can become better advocates for their loved ones with dementia when they understand what medications do and how they can be helpful, and whether they're really necessary or not, in order to provide the best opportunity for them to be able to communicate with their loved one who has dementia. If they can somehow try their very best, you know, and I'm sure most people are, they're trying their very best. It's never an easy situation, but to see whether or not they may be under or over medicated, and whether the medications they're taking are actually necessary. Another just important fact that we'll follow up with on the next slide is referencing bedridden individuals with dementia, who specifically, they'll suffer from boredom and loneliness due to the lack of social engagement and meaningful activities. So a decrease in social engagement and meaningful activities can lead to that boredom and loneliness, which can also lead to more aggression or cognitive impairments, or a lack of ability to communicate, because say they've been put in a room and not able to have many social engagements for several days or several weeks. It can be much harder to communicate and have that conversation, have any sort of conversation with them, if they haven't, in a sense, been able to practice or been able to engage with people in a while. So referencing that, I wanted to share some meaningful nonverbal communication interactions you may be able to try with those who are living with dementia. Some of the really common ones are sharing pictures of people they may recognize, or even people they don't. It could be pictures of animals or places and things like that that can invoke any sort of emotion from them, as well as touching when it's appropriate and when the person is welcoming of that, touching of the hand or giving them a hug, as well as smiling and facial expressions. Those are a huge thing when somebody knows that you're paying attention and that you're showing that you're you know, happy or smiling. The person who's living with dementia may often reflect that or mirror that when they see that on your face. Another idea is to activate the 5 senses. Taste, touch, smell, hearing, and sight can help encourage connection, especially if the food or scents, music, or photos are from the individual's past. One example was our nurse at Hospice of Anchorage. After we all watched the Alive Inside documentary, she was able to order the earphones that the Alive Inside documentary references to help individuals living with dementia to connect with music in their past. So we were able to order those earphones and download music for a particular client, kind of her earlier years, music she may have listened to. And we took the earphones to her and asked her if it was okay if we listened to music, and she was very okay with that. And we placed the earphones on her ears, and it was amazing to see the reaction that she had to the music. When she often struggles with being able to create full sentences, she was able to sing along with the songs that were on the earphones, and she was smiling and dancing and just more interactive than I think we'd ever seen her. And she would even at some point in time, she'd say out loud, you know, like, I remember this song. So it was a pretty incredible experience with somebody who we often aren't able to communicate very effectively with, but providing the music really brought her joy and brought an opportunity for us to interact in a way we hadn't before. And as well as after her listening to the music, we were able to kind of have more effective conversations. She was able to fully form sentences, and that was it made the music seem even more powerful, which was great. Another example is creating a photo album of the individual's family of origin or where they grew up, something that may trigger a memory or something where they may recognize the faces. Again, try not asking about names of people or who they might be, but if your loved one is looking at it and they recognize those faces, or they might start telling you stories about the people they see in the photos, that can be a really powerful thing. Along with the sensory engagement, one idea was cooking food at the bedside that could invoke sensory memories through smell, or if they had a spouse or a loved one who wore a certain cologne or perfume, and having them smell that and seeing if that brings them any sort of comfort or joy, or even a candle a scent that they may have smelled often in the past. So things like that can really invoke memories, bring out stories in them, or just bring them comfort in a time where everything can seem really out of control for them. And like we said, playing music is definitely important. So another topic around end-of-life communication we wanted to touch on was communicating with those who are living with ALS or related diagnoses. Just a few diagnoses listed below here are some of the situations that may lead to lack of speech and often lack of a lot of physical ability. But even though they are not able to speak or write with their hands or use any part of their body, they're still very much mentally alert and able to comprehend their wishes and needs, and really would probably like to have a conversation, but physically are not able to. So just a few of those situations I put on here, which is ALS or PSP, the locked-in syndrome or Parkinson's disease. This is by no means an extensive list, but just a few that Hospice of Anchorage, that myself, that I'm familiar with, to talk with you about a little bit here. I wanted to share a video that was shared with me by one of our volunteers who has a lot of experience with ALS, and I'll tell you a little bit about her in the next video. But this is someone she knew from New York who has been living with ALS for, I believe, 10 years now. His name is Jason, and this is his dad, who created this system for him to be able to communicate in order for his son to have a voice and to share his wishes, needs, or just his personality. So I want to share this with you.
H-E, hey, L-A, ladies and gentlemen. T-H-I, this is J-A, Jason B. Becker. T-H, the S-E-X-iest, sexiest man alive. I am my D-A, dad, A and I, W-A, wanted to, S-H-O-U-H, how I, C-O, communicate, A-N, and, W, H-O, hope, T-H, that, P, people, W-H, who, in need, O, our S system, C, A, can, B, H, E, helped. N, O, now, H, here, is, M, my, P, O, pop, pops. Hi, this is Gary Becker, the ugliest man alive, Jason's father. I invented this simple system when I could no longer understand Jason and I needed to be able to communicate with him. And I wanted the simplest, quickest method possible. So I took basically a grid of 6 squares, took the alphabet, put 4 letters in each square, that's 24, 2 letters left over, Y and Z down here in the corner. So every letter of the alphabet has 2 eye movements. The first eye movement takes you to the square. The second eye movement takes you to the letter in the square. So Jason's eyes begin each letter from this point. He will look in one of these 6 directions to take me, for example, to this square. He'll look up over here. And if he looks over here, that's the letter A. If he looks down here and back over there, that's the letter O. So each letter, he will do 2 continuous eye movements. It's kind of an eye geometry to take me to the letter. I'll say the letter, then the next letter. When I know the word, I'll say the word. And he can say long sentences with just a handful of letters. So Jason will now demonstrate. Is this board in a good position? Down a little bit? Okay, so we'll have Jason spell a word and I'll kind of point it out as he goes. So, are you ready? A. There is the square. I'm sorry. There's the square. There's the letters. So that is D. There's the square. There's the letter. That is O. There's the square. There's the letter G. He just said D-O-G. That is dog. A. Okay. Continue. O. K. W. E. We. R. E. A. Really. H. O. Hope. T. H. I. This. C. A. Can. H. Help. S. O. Some. F. O. Folks. Thank you. Here is a clearer picture of the training board we use on Jason's system. You can see the letters are backwards. That's because the side that Jason sees is forwards. So one or the other are going to have to see it backwards. But this gives a clearer picture of what we were using.
That's pretty amazing to see how he was able to communicate so well just through his eye movements. And he was able to complete those full sentences. And clearly they've had a lot of practice and have spent time working on this and using this system. So his dad is very familiar with what words he might be trying to say, and at some point can even begin to guess as he identifies one letter. So that's pretty incredible. After watching this, I just had a couple of questions to mention for you to think about. You know, as we view this, what are your first thoughts about this means of communication? Some of my first thoughts were that it takes time, it takes patience and persistence, but it is absolutely worth your time in order to help a patient have a voice and communicate and be heard. Another question is, what do you notice about the relationship between this dad and son? My first thoughts were that this dad is clearly his son's #1 fan. Dad wants to be sure that his son has a voice and communicate what he needs and wants to. And my last question for you is, can you imagine not being able to speak, write, or communicate with anyone? How would you want someone to help you have a voice and communicate your needs effectively? a few questions for reflection. I have another quick video to share with you. This one is called Robin's Smile. The man in this video's name was Robin, and it's a courtesy of Kim Millett, who is one of our Hospice of Anchorage volunteers. And this was her husband, who was living with ALS for several years. And she was gracious enough to share this video with us of them also using the vocal eyes movement system for him to communicate. And we'll talk a little bit about it afterwards.
Monica?
Yes?
Can you make Robin laugh or smile? Just try.
Well, that wasn't very hard.
Kim, can you make Robin laugh or smile?
I guess so.
Okay.
I think it's life.
Robin, here's my question. What makes you smile?
I am A L W A U L A. Is it laugh? I am L A W A S U Y. I am a way B A L W. I am always. I am always X. No. O S M. I'm always smiling.
Why?
L I F. Life. S. Life is A B L
A S.
blast. Life is a blast.
Thank you, Robin. Do me a favor, do a false hysterical laugh. Just laugh. Laughter is good thing. Robin, go for it.
You're traveling.
The video always makes me smile. So that was actually 3 weeks before Robin died. So it's a pretty special video and really special for Kim to share that with us. So Kim was married to Robin for several years, helping him with his journey through ALS. And Kim worked tirelessly to make sure that Robin had a voice and could communicate with those around him. Kim is now extremely passionate about teaching others about communication options for those with ALS or related diagnoses so that they have the opportunity to have a voice and be heard even when their disease progression makes it extremely difficult. And this is just one of those incredible examples of allowing somebody who can't verbally communicate anymore still be able to share their sense of humor and their joy and their wants and needs. So I wanted to share a couple of other resources for technological communication support. Like I said, the videos with Robin and Jason were using vocal eyes. That's what they refer to as the board they were using. There's also different devices called the Dynabox, which is another type of computer program that allows you to, it recognizes your eyesight and what you're trying to look at on the screen, so very high tech. Hopefully you're able to click on these in your presentation, otherwise I'll send the links alongside this video. There's also the You Can Talk app, which provides, you can download it on your iPad or your phone or any type of smart device, and it gives you different categories and things the person just has to tap with their finger. So if they still have the ability to tap with their finger, they can choose the category, choose whatever it might be they're trying to communicate from that category. So it kind of gives them options of what they're trying to say. And then there's also something that's called the NeuroNode Trilogy that I'm not super familiar with, but is definitely one of those high-tech things, computer connected, and I believe something similar to, like what Stephen Hawking's used to communicate with, where it speaks for you and can gather the words you're trying to share. This is by no means all of the devices that are available. This is just kind of a quick overview of some of the options that are out there that I wanted to share with you. And there is that situation when communication is no longer an option. One of the best pieces of advice for anybody, way before you get to end of life, or when you, just anytime you have the opportunity, is to have those conversations about your end of life care and wishes, because it can significantly reduce family distress when communication is no longer possible, whether it's due to illness or an accident or just whatever situation it might be. Having those conversations ahead of time can really decrease stress on family members for making those decisions for you when they may not know what your wishes are. So that can be hard. Assume that the patient can hear and understand everything when you are talking near them. Acknowledge them directly in conversation, even if they cannot engage in the conversation with you, or they don't seem to be coherent to what's going on. It is best to always assume they can hear everything and to still acknowledge them directly in conversation, that they are presently there. The worst thing we can do is to treat people like they are invisible when they can no longer communicate the way they had before, or even for people who've not been able to communicate for a long time, or maybe ever at all. It's just really important to still acknowledge them directly as if they're a human being. They're a person who should be treated respectfully as well. A little note in here from Kim, actually, our volunteer we're referring to. She wanted me to make sure and share that if your loved one can no longer speak, please remember and remind others that they are not deaf. Unless they had already been deaf or hard of hearing before, there's no need to raise your voice when speaking to them. She just referenced, there were even times they'd gone to doctor's appointments and the doctors would speak to her husband as if he was deaf and that he couldn't hear the doctor talking to him. So the doctor would raise his voice, and Kim's husband, Robin, would have to remind her, or to ask her to tell the doctor, remind him, I'm not deaf, I can hear you perfectly well. Just because I can't respond to what you're saying doesn't mean I can't hear you. So just a good reminder there. And then it does get to a point where, just that physical touch and physical presence are still very powerful in communicating that the individual is not alone. Even if it may feel like they have no idea that you're there, a lot of times we don't know what they're seeing, feeling, or when they know where they are not. But it has been shown that having a person physically present, even if they don't seem to be conscious or awake, still feel that comfort and peace when they know somebody is there with them. So a few other resources I wanted to share are here. Like I said, I'll have to include the links in email I send out, or please email me after this presentation if you can't access them. But just resources around communicating your wishes, how to have those conversations around end of life, how to communicate with your loved ones or with your doctors or medical professionals. There's also a resource here for enabling devices for communication. So more options for what is out there to help communication with individuals who are struggling. There's also a resource specific to those who are in Anchorage or can get to Anchorage in some way, which is the ATLA communication methods. They offer different devices as well that can help with communication, as well as just resources and support for those who need assistive devices. And then there's also a resource here called Vital Talk, which is really helpful, especially for clinicians, doctors, nurses, medical professionals who are looking for better ways to have those end-of-life conversations, or just to be able to communicate about really difficult things in terms of terminal illness. And I just put a few of those points on here that are important to pay attention to as professionals, such as establishing rapport, offering prognostic information, bearing witness to the end, tracking and responding to patients' emotion, diffusing conflicts, and staying strong. Just a couple of those really important factors to pay attention to as professionals. Also just wanted to include some of my references where I've gathered information from studies and that I've included in this presentation. And my contact information. If you have any questions about this presentation, or you'd like to chat more about end-of-life communication, or would like to hear more about Hospice of Anchorage, what we do, who we are, please feel free to email me at Sarah, S-A-R-H, at hospiceofanchorage.org. Or you can always contact our office at 907-561-5322. We work with anyone who has a life-limiting illness, and that we can come alongside and support in the best way we can, provide resources, connect you to different areas around Anchorage that may be helpful to you. We would be more than happy to help you and provide support. So if you or someone you know could use that help or support, please feel free to give us a call or to send me an email, and I'm happy to chat with you. And if anything in this presentation you have more questions about, or if you'd like the resources for, again, please feel free to email me and I'd be happy to send them to you. Otherwise, I look forward to hopefully seeing you in person in the coming months. If not, maybe we'll send out another virtual training. But thank you so much for joining us, and we'll see you later.